Hello, I'm Liz Phillips and I'm the Maternity and Neonatal Commissioning and Transformation Manager for Cambridge and Peterborough CCG, but I work mainly within the local maternity and neonatal system within our area. And I have got Phasia on the call as well, who this wouldn't have been possible without. So as a system, we work across the whole of Cambridgeshire and Peterborough. We're a single CCG covering 2 trusts that provide maternity care on 3 sites with approximately 10,500 births a year. This project focused on engaging with women and their partners who are from ethnic minorities to support encouraging the lifting of hidden aspects of perinatal mental health conversations, and also to encourage open talking and support through pregnancy, birth and immediately afterwards. So this is the outcome. The poor outcomes for pregnant women and their babies had already been highlighted as an issue with health inequality, and COVID-19 has further highlighted that inequity. The Raham project made us rethink as a system how to engage with our local communities to enable messages to be tailored to improve those health outcomes. So this project actually started within a community and it was community led, but what we've been able to do is offer support both in the practical sense and also financially, and to engage them within the work that we're doing. The passion of the lead is infectious and very thought-provoking to a level that makes you question our actions and to improve communications right across the board. So the main thing we did was the development of navigating the community to innovative videos to increase the reach. These were in different languages, subtitled, and some were picture-driven, so that's enabled more inclusion. And the videos have been accessed and shared multiple times across the country to benefit both patients and staff. So we were aiming to address the health inequality messages and engagement with this. So its aims from the Raham project were to create a safe and non-judgmental space for mums and partners to discuss all things related to pregnancy, childbirth and maternal mental health. Provide maternity support network for new mums or pregnant mums, educate and raise awareness of perinatal mental health issues, and help shape local services for the future based on their experiences and feedback. So these aims have been achieved and much more, and the shaping local services and has had such a major impact for us. So the Raham project integrates, as I mentioned earlier, with our local maternity and neonatal system, and as part of that we have service user voices through maternity and neonatal voices. So these are predominantly white middle-class women that form these groups. So by linking with the Raham project, it's acted as a focus to support for co-production and inclusivity within them. We've also been able to share messages regarding safety, individual rights, awareness of perinatal mental health, and placing messages in an inclusive format. Work is currently underway and in the planning to develop culturally sensitive antenatal classes for women as well. The work is recognised through sharing of information to improve the awareness, to improve safety for women during pregnancy and beyond, and to make sure we can develop membership and support the team behind the project to ensure its future sustainability. The plan is also to have face-to-face sessions within the community to support women further once COVID-19 restrictions enable this. So the impact and awareness has been the spread of this via social media, and it's really enabled the work of the Raham project to be accessed worldwide. I know they have contacts from across the world, and actually when they have an open session for service users to join, they're often outside our area as well. And Phasia has also been able to advise other groups to set up in a similar way. We've also gained recognition for it at the England-wide Better Births 5-year on event in March. This was highlighted as an innovative practice by the Chief Midwife for England. And as I mentioned earlier, it's been contacted by women and their families and healthcare professionals to request how they started and developed. There have been multiple requests to reshare the information produced to enable further support for women and their families across the country and wider. So the results that have been achieved are the regard with which the Raham project is held within the community health system wide, regionally, nationally, deserves recognition. The importance of engagement through members of the local community to engage them directly and enable tailored information and easy to understand material that is sensitive to the audience, we felt only can come from within the community. And the worth and usefulness of the Raham project enables women to reach out through a private Facebook page and allows wider understanding across the community. The value to the maternity team personally has been an awareness of the need to reach out to communities, tailor communications, and further understand the differing cultural needs of the largest group of ethnic minorities within our area. So for future success, the main involvement has been with the community, and engagement from members within the community has created this success. So the next is further involvement with all members of the local maternity and neonatal system across Cambridgeshire and Peterborough, and supporting us with the tailored messages to support even wider engagement. This is widened and also shared across the east of England and nationally. Involvement with maternity and neonatal voices both locally and nationally to engage with women from ethnic minorities, ensure they are aware of improving safety for themselves and their babies. So this was just to give you a few examples of the tailored messaging that has been undertaken. So this is giving a bit about birth rights, mental health, just simple messages that are put on Facebook, and there are some videos as well, but these happen to just be pictures. And this is Phasia featuring there, so we couldn't do it without her. And that's all the things that she's sort of been linked in with, and particularly did a Ramadan and pregnancy focus as well, which was really useful that time. So the results and outcomes are more inclusivity across our maternity and neonatal system, developing sustainable relationships and ways of working to improve health outcomes for all, co-production and engagement across boundaries that were difficult to achieve, being able to share crucial health messages, particularly for COVID-19 as well as for pregnancy. And we've had increased uptake of safety and prevention messages as a result, and the ability to engage more with ethnic minorities in a variety of formats for accessibility and understanding. So what makes this initiative stand out? So just spelt out Raham and put retain involvement with the community through tailored messaging to improve outcomes for our population, adaptable messaging that includes subtitles in different languages to improve awareness and leads on to improved health outcomes, having videos available to share widely, access to utilise the community relationship to continue to support delivering maternity care through continuity of care with this population and considering culturally sensitive information, and then modelling this way of community engagement with other groups to support health inequalities. And then just in this presentation, there are some links to the videos if people would like to look at any of them.